today's webinar, Best of the Symposium, Total Worker Health, brought to you by the Campbell Institute, the Center of Influence for EHS at the National Safety Council. Allow me to introduce you to today's speaker. Dr. L. Casey Chosewood is the Senior Medical Officer for Work-Life Programs at the National Institute for Occupational Safety and Health, part of the Centers for Disease Control and Prevention. In this role, he promotes the protection, preservation, and improvement of the health and well-being of workers everywhere. From 2004 to 2009, he served as the Director of the Office of Health and Safety at CDC, where he was charged with protecting the 15,000 members of the CDC workforce as they faced the new challenges of the modern public health era. Now I'll turn it over to Dr. Chosewood for his encore presentation explaining the Total Worker Health Program originally given at the 2015 Campbell Institute Symposium. Dr. Chosewood?
Well, thank you very much, and hello everybody. I appreciate your time today, and I'm looking forward to spending the next hour with you talking about the NIOSH Total Worker Health Program, as well as an important topic that I think will resonate with each of you. You know, everybody has worked in the past, likely is working now, and if you're not, you're likely to work in the future. Work is just an essential component of life for almost everybody who is born, and that's true really for all of us. So the importance of work in our lives really cannot be underestimated, and I think this is going to be an important theme that not only we will deal with today, but that's going to become increasingly important as we try to find ways to improve the health and well-being of our nation. So today we're going to sort of give you a review of some of the things that we did present at the earlier meeting, but I've also added in quite a bit of new information that I hope will, even if you attended before, you will find this hour very, very useful, compelling, and hopefully open some new ideas and spur some new action from your part as you work to improve the health and well-being of workers. First of all, let me say thanks to the folks at the National Safety Council and specifically at the Campbell Institute. We consider them extremely important partners of NIOSH in protecting the health, safety, and well-being of the American workforce. And they're really exceptional partners. So thank you to you guys for the invitation today. I am going to be presenting a variety of information, some of which is cleared by the National Institute for Occupational Safety and Health as actual guidance, but I will also throw in some opinions. Some of the latest information that I'll be presenting is brand new and hasn't been formally disseminated by NIOSH or cleared. So if you want official cleared guidance, please go to our website. All of that information is official policy and cleared. But I will be throwing in some additional newer information today that may represent not cleared guidance from NIOSH. So just in a quick overview of the definition of total worker health, it's really quite simple. Let's start by keeping workers safe. Let's let workers come to work in the morning and at the very least send them home at the end of the day with the same level of health that they arrived. That's all good and well. There are unfortunately a lot of companies that don't do that. We would certainly not say they're ready for a total worker health approach. But I would like to make the argument that that in and of itself, just keeping workers safe on the job, is great, but it's not enough because it leaves tremendous health opportunity on the table. The best companies invest more in the health of their workers each and every day. They create conditions, built environments, policy environments where health can succeed in the workplace. And at the end of the day, hopefully we're creating greater worker well-being. Now obviously that benefits the worker, him or herself. It benefits their family. It allows them to have control over how long they work, when they retire. Hopefully it allows them better enjoyment of life away from work and more ability to care for the needs of families and others that depend on them. But here's the good news of this sort of positive cycle that we're demonstrating on this slide. When those workers who've gone home at the end of the day with more health than they arrived with that morning, they bring that home to their families and communities, but yet the next day they wake up with that additional level of health and they bring it back to the workplace with them. And it's that continuous cycle of improving health that really is the promise of total worker health. And when they bring that additional health back with them to the workplace, they bring back more resiliency, more engagement in work, greater participation in the workplace, less likelihood of injury or illness related to work, more productivity. And really this is where all parts of this cycle, everyone contributes. The goal in total worker health is really quite simple. And it begs the question, can we create jobs that produce both an income, a decent living wage, but also desirable health outcomes? And we believe the answer to that is yes. Today I'm going to be sharing with you, and this is some new information, 7 critical strategies for advancing the health, safety, and well-being of your workers. And they will be call-out boxes that I think will be the important take-home messages for today's presentation. Well, we're not in Las Vegas. Most likely some of you are at home in your pajamas right now. So, but I put this slide up to say a couple of things. One, unlike what happens in Vegas, where what happens in Vegas stays in Vegas, what happens at work doesn't stay at work. We shuttle those challenges and risks home with us every day. And what happens at home, by the way, doesn't stay at home. We bring those challenges with us to the work. Just like we pack a lunch, we pack all the challenges that we're experiencing as people in our families, communities, homes. We bring some of those challenges with us to the workplace. This shuttling back and forth of risks is why a total worker health approach is important. A holistic look at what workers need to succeed on the job. What challenges are workers having that we can use the workplace to create better outcomes, safer outcomes, fewer injuries and illnesses, and overall improvements of health. When we recognize that important connection between work and home, we start addressing some of the most critical challenges that workers face. This is a neat slide that looks at the intersection really between the blue home time we spend and the red work time we spend. And this is sort of a traditional view that there is a firm delineation between home and work, and that there are a lot of challenges that lie along that intersection. Some about how well we eat because of the demands of our job, and even our income on the job might determine largely our diet. Tobacco. We know by very strong research that the job you have predicts whether you're likely or not to be a smoker. Controlling for all other factors, just the absolute job you do is a strong predictor of whether or not you will be a smoker. Noise exposures and other chemical exposures and stress exposures happen in both settings, and they're at this intersection shuttling back and forth. Substance abuse also, we know certain jobs predispose to heavier use of substances. The whole issue with sleep and fatigue and shift work, extremely connected to our overall health and well-being. I would also make the argument that this traditional view of a firm delineation of between red and blue on this graphic is actually today becoming more like a sea of purple. What is work at home and what is home at work is becoming blurred. Many of us don't have a traditional job where we go to an office or a factory or a building and spend 8 hours and then come home. In fact, it's more common that we have jobs that have multiple work sites and workplaces, or even multiple jobs that we piece together to have one income. So that really brings in yet another level of complexity to this intersection of work and home. We're going to be talking about that today over the next hour. So here's my first takeaway. Don't underestimate the connection between our health at work and our health away from work. You cannot separate these. They're inextricably linked. And the influence of one on the other is a critical piece of understanding the promise and the value of a total worker health approach. Many of you watch these shows. They're some of the most popular in their time slots and in the genre. If you're a male 18 to 35, these represent some of your most popular viewings. I use them in this presentation to remind us that there's a lot of dangerous work still out there. In fact, if you look at some of the statistics, these shows represent the most deadly of all jobs. And this is 2011 data, but the 2014 data, which has just come out, is extremely similar. Fishermen, loggers, and pilots have some of the most deadly work that there is in this country. And when we say pilots, we don't mean like U.S. Airways or American or Delta Airlines. We're talking about those pilots who do puddle jumping, short trips into very ominous areas like maybe remote areas or Alaska, where the only access to an area for parts of the year are through shuttle flights to bring supplies and people in and out. But these are not the only jobs that are dangerous, those that sort of get their headlines in their own reality TV series. There's a lot of routine and regular work as well that causes quite a bit of risk. This is updated data. So the most recent data we have looks at statistics through 2014. It was just released on September 17th of this year. And it looks at the number of fatal work injuries per year. And it compares it to that rate or that number in 1970, which was about 14,000 fatal work injuries per year. If you compare that to 44 years later, we're at 4,679 workers who died in 2014. So there is marked improvement over the last 44 years, but we still have a long way to go. That still equates to about 12 to 13 workers a day who will die on the job, and you can see the financial burden is quite great. It represents about 2% of the full U.S. gross domestic product. Also keep in mind here on the third bullet that there is still a considerable amount of workplace injury. And it's NIOSH's belief that this is a marked underestimate of the actual amount of illness and injury that occurs, especially if you're looking at the illness that arises from work that develops slowly. Sure, it's pretty straightforward when someone gets a puncture wound or a nail gun injury, but if someone's exposed to certain conditions of work over decades, whether that's a respiratory hazard, silica perhaps, or asbestos, or a chronic stressor on the job, or some chronic chemical, it's oftentimes difficult to make the connection between that long-term exposure and some sort of chronic disease outcome down the road. Because we have much better surveillance systems now than ever before, there actually is the ability for NIOSH to start predicting some of these chronic disease outcomes as it relates to work. And we're going to be investing more in that because we know that that's an important new horizon for understanding the actual true risks of work. I put these pictures up to remind us that some of the most hazardous jobs are quite common. High-speed manufacturing or food processing, service workers, convenience store workers, people who do agriculture, people who do transportation jobs, home health care aides. These represent booming parts of our economy, and unfortunately parts of our economy where there are still considerable workplace stressors, health risks, and challenges. So it's not only the bizarre fisherman or pilot or the unusual logger in a remote Northwest territory that has risk. Day in and day out, there are risks that workers face. This is a fascinating slide, and I know it's busy, so I'm just going to draw your attention to two components. What's above and below the line is really what matters here. So above the midline horizontal black line is what people perceive their day in and day out risks to be. Underneath it in the corresponding color is what their actual risk is. So take a look at the biggest blue circle above the line. That's people's perceived risk of a terrorist attack. Now I want you to compare that to their actual real risk of a terrorist attack below the line, the tiny blue dot just below that blue, large blue one above. So you can see that people in general perceive certain risks like a violent robbery or avian flu, a stock exchange crash. Those are perceived risks greater than their actual risk. But now let's move to the other end of the curve and take a look at the big black circle below the line. That's people's actual real risks for work-related exposures and injuries. And compare it to what people actually perceive that risk to be, the small white bubble circle above the big black one. That's what people perceive their work risk to be. I put this up to remind us that people inherently underestimate the influence that their work, their job, their daily toil has on their overall health and well-being. Here's critical strategy number 2. I want us all to be mindful of the significant pervasive risks that work conditions represent to our overall health and well-being. Because they're there, and our tendency is to underestimate their impact on our own health and safety. I talked to you about the bad company that doesn't protect their workers, the average company that at least keeps them safe on the job and protects them from injury and illness, but it's the excellent company that does that and then invests additional in their health each and every day so that they go home with greater well-being. That's a company that gets total worker health. We define total worker health as all those policies, programs, and practices that you pull together that all have worker health in mind with the goal of protecting people from work-related injury, but not stopping there, and then promoting injury and illness prevention efforts both on the job and away. So it's protect the baseline and then go above the baseline so that you can invest more in the health and well-being of workers. This is the equation that I presented earlier. I just put it up to remind us that total worker health is not a standalone health promotion program or a workplace wellness program, because oftentimes those are absent. They don't have any connection to the actual conditions or nature of work. Total worker health is taking this holistic view that safety, health, and well-being are strongly connected, and we have responsibilities at each level of this equation if we want to produce total worker health at the end of the day. If you don't have the cornerstone of worker protection in place, it's not total worker health. My guess is this guy in this picture is not all that interested in the noonday Tai Chi, right? This guy is probably more interested in, let's improve these exposure conditions, the silica that I could be exposed to in this setting, or other harmful respiratory exposures. That really is where the focus of his needs are, not in whether or not there's a health risk appraisal to ask me about my behaviors if I had 5 fruits and vegetables today. Now, it's not to say that 5 fruits and vegetables are not important to this person, but we have a prioritization of keeping workers safe. The job should not shorten their life. A take-home benefit of work should not be an increased risk for chronic disease, nor should it be early path to disability, increased morbidity, or increased mortality. We also think that a lot of traditional workplace wellness programs shortchange their potential impact by focusing quite a bit on individual behavior change. This is one of my favorite quotes from Sir Michael Marmot, who's considered the modern father of the social determinants of health. And he said, "It's unreasonable to expect people to change their behavior when the social, cultural, and physical environments around them fully conspire against them." So for me, this says that for every behavior change program we want to put in place in work, and I would say this is true whether it's safety or wellness or well-being or EAP or whatever, we want to change the environment before we expect people to change their behavior. Let's change the social milieu in which work occurs. Let's change the culture. Let's change the built environment, the policy environment, because those are much more powerful interventions than only focusing on individual behavior change. For one thing, individual behavior focus is expensive and it's time consuming, and it's oftentimes takes multiple attempts and a lot of effort and expense to change behavior in the long term. Whereas those other more pervasive, built-in, sustainable changes that we're talking about impact every single worker in the space now and in the future. It's oftentimes helpful for us to differentiate ourselves from employee wellness programs because, unfortunately, that's been oftentimes a comparison. Oh, total worker health is just another type of wellness program. We actually believe that it's important to differentiate ourselves from that. And if organizations are not starting with this baseline of providing safe and healthful working conditions, certainly we wouldn't say that's total worker health. We're also very much interested in, does the way work is organized and structured contribute to worker injury and illness? And I mentioned we're increasingly concerned about the development of chronic diseases related to work conditions. Cardiovascular disease, depression, anxiety, all have been linked to certain work patterns, work conditions, and we believe that there are fixes for those challenges. We believe that a total worker health approach can address those poor relationships between work and these health outcomes. We also know, unfortunately, that a lot of wellness programs, we would say, don't have a good evidence base, and they may promote interventions that are unproven value, or they may lead to additional screening or over-screening that could put people into situations where they might be harmed from some of over-screening. So imagine a scenario where someone has a screening that yields an abnormality that then requires several other tests or interventions, each of which has its own potential downside. You could see where over-screening or screening in the wrong age group or the wrong risk population could potentially lead to inadvertent medical harm to those people who participate. When wellness programs also don't ask employees about work factors that they think are contributing to their stress, in other words, if there's not a participatory component to the program, we think it falls short of a total worker health approach. And these, many of you know the director of NIOSH, Dr. John Howard. These are his own quotes, so we like to share them because we think it's a good way to remind us of how we do need to develop a total worker health approach. We do need to focus on safe and healthful working conditions. We do need to worry about the way work is organized. We do need to make sure there's an evidence base for everything we recommend when it comes to improving health. And we do obviously need to look at the role that stress plays in the development of chronic disease outcomes. Critical strategy number 3, let's focus first on culture building. Policies represent our best and most sort of our method of operations, our MO, if you will, and we believe they are what guide to sustainable health outcomes. So we are asking this question because of, I alluded to earlier, this sort of changing way that we work. We no longer have one job for a lifetime and retire. We no longer go to work from 9 to 5. We have what many are calling a gig economy, where we piece together a lot of different jobs in order to make one set of work that leads to an income. So many people are asking the question, where have all the good jobs gone? And here is our sort of essential list of what we think represents very important, very health-centric challenges. And we would say that worker-centered operations and this participatory model that I mentioned are extremely important. It isn't so much if you build it, they will come, or if you build it, they will follow. It's if they build it, they will come. If they have a voice in solving the challenges that are present in the workplace, they're far more likely to not only buy into the solution, but it's likely to be a better solution because it's the people on the front line who oftentimes are the most able to solve the challenges that are hampering either a safety challenge or a production challenge or an interpersonal or a conflict. They're oftentimes closest to the issue and have the best insight and understanding to solving the issue. We also know that there are downsides to low wages, so we use the term equitable wages. We don't have a political position within NIOSH on minimum wage. We just really let the research speak for itself. And there's strong research that wage level is a strong predictor of health outcomes. So lower wage folks invariably are going to have poor health outcomes. It's scientifically true. That it's not a debatable thing. I mean, we see that time and time again. And we are also concerned that oftentimes it's the lowest paid workers who have the most dangerous work. Lowest paid workers oftentimes have the fewest protections in place. They may not have paid sick leave. They may not have paid medical benefits. They're oftentimes contractors, subcontractors that are multiple levels away from the actual owner-operator of an organization. And that distance, as that distance grows between who sort of oversees the work of that person and the one paying the ultimate bill for that work, as that distance grows, the opportunity for increased injury and illness and poor health outcomes dramatically rises. And that's another important challenge that we see facing all occupational safety and health professionals as our economy evolves. Here's a question I have for you. Can the job you have predict your chances of being overweight or obese? So let's say I compare you and your work to a group of people exactly like you, except for one thing. They have a different job. So they're your same age, they're from the same region of the country, they're your same gender, and the only real statistical difference, if you will, is the type of job you have. Are you going to have different obesity outcomes? Well, the answer is a definite yes. This slide really looks at those occupations, after controlling for all things that might be confounding this, just looking at the work people do, how they spend the majority of their waking hours. Is it a predictor of obesity? It absolutely is. And it may be startling for you to see some of the most obese occupations. Police officers, firefighters, and security guards. Compare their obesity rate almost 3 times the rate for the leanest occupation, economists, scientists, and psychologists. The average U.S. worker obesity rate is about 28%. So you can see that you have almost a 50% increase of obesity compared to the average worker if you are one of these highest listed occupations here. It's extremely vital for us to get this right and to understand that at the end of the day, we're not talking about fat workers, we're talking about fat jobs. Here's another example that looks at nursing home workers. And these are people who are have a mid-skill level when it comes to medical care. This is a growing segment of our population as our population ages, so this part of the workforce is growing. And it looks at the number of workplace stressors that this work group faced and their risk for obesity. And it looked at things like low decision latitude, poor coworker support, heavy lifting, night work, physical assault at work in the past 3 months. And depending on the number of these hazards that you were exposed to in the past 3 months, it could predict your risk for obesity. So the more of these stressors you had, your higher odds ratio for being obese. In fact, if you had all 5 stressors, you were 4 times more likely to be obese than someone without any of these stressors. In summary, I believe to impact the epidemic of obesity among workers, we have to fix fat jobs and not focus only on fat workers. It's the job itself, the way it's been crafted and organized, that's leading to obesity outcomes, a critical public health issue for our country. NIOSH just released studies on long-haul truck drivers. And you know, I showed earlier statistics looking at obesity rates in the highest group here, police officers, firefighters, security guards, at 40.7%. If we look at the subset of long-haul truck drivers, that figure is closer to 70%. 70% obesity rate, not obesity and overweight, just pure obesity, 70% in long-haul truck drivers. It should not be in the modern age that we've crafted a job that sends people to early disability and death based on how they spend their working day. We can do better than that as a nation. Here's another challenge that I'm sure you see each and every day. Some people call it the silver tsunami, the graying of the nation. This year in 2015, 1 in 5 Americans was 55 years of age or older. By 2020, just 5 years from now, or less than 5 years from now, 1 in 4 workers will be over age 65. So there's no doubt that we have a tremendous aging of our workforce, and that brings with it some positive things, but it also brings some significant challenges. And I really do think that we can't underestimate the importance of the changing nature of work based on age. So it begs the question that NIOSH has been grappling with for the past few years. Can we age productively? And when we ask that question, we're really saying, can we craft work? Can we create work conditions that allows people to age in place, to successfully stay on the job into their 7th decade, 8th decade? Can we actually find a way to create an economy that will allow people who need to work for a prolonged period of time because of their financial and economic concerns, or because they just simply want to work and stay engaged in the workplace for for extra years? Can we craft work that will allow people to age in place and still remain productive in paid or unpaid work? And to answer that question, NIOSH, under Dr. Howard's direction, has created the new National Center for Productive Aging and Work. And you guys are going to be one of the first to be able to see this website because it just went live yesterday. So if you will Google any time after today's lecture, if you will just Google the question or the phrase National Center for Productive Aging and Work or Productive Aging and Work, you should have the new site come up. It's brand new. It just went live yesterday, so I invite you to take a look at that. It will continue to be a source for information to help create age-friendly and age-productive workplaces. Here's the real tie between the challenges of aging and overall health, and that's because aging is directly related to the number of chronic diseases that Americans have. About half of all Americans have one chronic condition, and about half of this group have multiple conditions. In fact, JAMA says the most common chronic condition in this country is not heart disease, it's not diabetes, it's not obesity, it's something called multimorbidity, meaning people have more than one of these common conditions that I just listed. So how can we create age-friendly workplaces? At the very top of the list has to be the issue of giving more flexibility. That means how, when, where the work is done, how people can prioritize and have input into the nature of their work. The more flexibility you give workers, the more likely they're going to be able to remain in the workplace longer. Matching tasks to abilities. Not every person is going to be able to do over time every component of a job, but oftentimes older, more experienced workers have crafted solutions that younger workers don't know about or haven't yet learned. We also know that older workers can be exceptional mentors to younger workers and can show them safer, better ways, more productive ways to get the work done. That's why we encourage cross-generational interactions as an important intervention. It's important to accommodate medical self-care in the workplace because oftentimes people do need to take medications or monitor certain health conditions. Providing space for this, providing private storage facility for medications and certain dietary needs of older workers is important. And then doing aggressive, reasonable accommodations and return to work after injury and illness. Most people think, oh, older workers are going to fall more, they're going to get injured more. In truth, they do not. Older workers in general do not have higher rates of workplace injury. However, when those workplace injuries do occur, you're going to have much higher risk for disability, for prolonged absence for work, and more delayed in return to work. The last bullet I can't emphasize enough. I really do believe we need to require aging workforce management skills trainings for supervisors, and I would go even further to say we need to change the way we train supervisors in general to be more aligned with this new demands of our modern economy. A term that I'm using more frequently now is healthier supervision. Can we find a way to instill the skills in our frontline management so that they are able to recognize when workers are struggling, be early with interventions, give people additional flexibility intermittently based on their needs, understand the important social glue that work plays in positive outcomes for people's health. I believe that supervisors can be trained to understand and recognize those things. Critical strategy number 5, train supervisors with health outcomes in mind. Key areas to focus: new, younger, older, more vulnerable workers. Those would be people of color, people at lower wage jobs, people from communities and who have jobs where there are inherent built-in risks, oftentimes where benefits and opportunities are not in existence. It really brings up the point of the true need to customize any intervention. It may not be that all your workers need the same health intervention on the job. You may have different needs in one population in the same workplace and completely different needs and interventions in another. That's why the participatory approach is important and why so many sort of off-the-shelf, dropped-in-from-the-sky workplace wellness programs do not work or do not have high levels of participation because they're not built with the specific needs of the population in mind. Other key areas where supervisors can be trained: understanding the issue of work stress and their role in it. Oftentimes it's not people's stress from home that's contributing to their overall level stress. It's the unreasonable mismatch of demands from work and their ability to meet those demands, or the harshness, or the bullying, or the violence, or the subtle negative component of their supervision that's contributing to workplace stress. So workplace stress, don't automatically think EAP. Workplace stress, don't automatically think, oh, we need more resilient employees. When you hear the word workplace stress, think first, where is the stress coming from and what steps do we need to take to get rid of it? And oftentimes it is from a few mistrained or ill-equipped managers that are creating these conditions for a segment of the workplace. Also, I think managers and supervisors can be trained to recognize the red flags, know when an early intervention for a worker struggling can be. Here's another important concept, and we're going to wrap up in the next 10 minutes or so talking about this issue of the changing nature of employment, the changing relationship between worker and employer. We've talked about how a workplace is no longer a workplace, how the gig economy means people are piecing together a bunch of different jobs. But we're increasingly, perhaps the most rapid segment of our workforce is something called temporary employment or temp jobs or contingent work. And that's of great concern to us because contingent work has built into it a level of uncertainty that brings to bear a significant amount of workplace stress. If I'm unsure whether or not I will have this job a week from now or a month from now, that's probably one of the things that's on my mind almost all the time. It may be a distraction from my safety, from my behaviors. It certainly may impair my ability to think about other health challenges that I may be facing or to even have appropriate relationships with my family and those I care about. So temporary work, we believe, is a significant challenge facing this country. There are sort of three types of, and this is from Dr. Guy Standing, but he sort of labels three types of workers in the 21st century. The salariates, many of you are probably salaried employees, have sort of a traditional job, 9 to 5. They're oftentimes in the private sector, but getting fewer and fewer, a lot still in the government. Then there's the proficients. These are the people who are very highly trained and technical. So think of maybe the migrant IT professional who moves from city to city or place to place helping employers set up IT systems, or maybe the ICU nurse who works on a per diem basis in Boston for a month and then goes to California for 3 months. And so these folks are going to do fairly well because they're in high demand and they're not likely to have periods of unemployment. But it's that third group that we're most concerned about, the precariats, and that's the same word, the root word for precarious. So these are those workers where employment is typically short-lived, it's uncertain, it's oftentimes migratory, and not by choice as with the proficient, but involuntarily migratory. And oftentimes these are people who have jobs that don't have built-in benefits, built-in paid sick leave. They might not even have really good workers' compensation protection, even though that's a requirement by law. Or these may be the people who contract and have multiple independent contracting jobs, and they themselves are responsible for any of these benefits. So it's this last group where we see a significant amount of risk. Here's just examples: the serial subcontractor, the dual employer where you have multiple people all on the same job site, but their employment relationships are all completely different. And this has led to what we would term as some major organizational changes that have tremendous health impacts. The whole issue of work intensification, downsizing, mandatory overtime, even if people don't want it, to keep your job you have to work prolonged hours. Lack of paid medical and family leave, and certainly the stress that comes from that kind of situation. Here's an important slide that takes a look at the growth of temporary work in this country. And it's the red line on the graphic, and you can see temporary work is at the highest rate that it's ever been in the country, whereas the traditional, maybe union-type job is rapidly decreasing. You can see that number's dropped by 50%, whereas the number of folks who are now considered temporary work has more than doubled. And this is just in the last half generation. There's little job security, low wages, oftentimes minimal opportunity for advancement. And again, these are the folks who perform oftentimes the most hazardous work. And even though it's a small percentage in some areas, it's rapidly growing, and these folks disproportionately bear the burden of workplace injury and illness. We know that there are a tremendous number of health effects related to this. Oftentimes one of the most immediate is that these folks do not have adequate coverage after injury and illness. And we worry that with this separation of traditional employer and employee, that on the third bullet there, employers do not directly pay for workers' compensation and health insurance for, let's say, a subcontractor that's on their job site. So because they're insulated from directly paying the cost of these worker injuries, they may not respond as readily to correct harmful conditions in their workplace. So they are they're insulated, if you will, from the true cost of the hazardous conditions in their workplace because the person actually facing those hazardous conditions is not their direct employee. And that distancing is of great concern to NIOSH. We're also knowing now the importance of the issue of paid sick leave. Many people would say, oh my goodness, paid sick leave, if you give people more leave, they're going to take it. Well, in truth, this study actually doesn't show that to be the case. And this looked at the relationship between paid sick leave and the actual incidence of occupational injury. So were people more likely to report and to have a non-fatal occupational injury if they had access to paid sick leave or not? And we looked at that. We looked at the business case of that. And we looked at some of the economic returns related to that. And here's the interesting statistic. What did we find? There was actually a lower injury likelihood in those workplaces where people had access to paid sick leave compared to those workplaces where people did not have access to paid sick leave. And this was a significant decrease in the injury likelihood, 28%. Now yes, the association varied across different industry sectors, and I'll share that information with you on the next slide. And we believe that introducing or expanding paid sick leave will help businesses reduce the incidence of injuries. It's more likely to lower risk in those more dangerous sectors of our economy, and we estimate that employers could save billions of dollars per year, or about $1,000 on average per worker by offering paid sick leave. So it's not a cost per se, there's actually a savings because of the associated decrease in injury from improving the climate oftentimes. So our supposition is really that those organizations with access to paid sick leave have an improved culture of safety, have a shared commitment to better working conditions, and we believe that's why this improvement in injury rates is occurring. Here you can see the relative difference between by a sector across the bottom of these are non-fatal injury rates based on those that had paid sick leave in red and those that had no paid sick leave in red and those that did have paid sick leave in green. And you can see a substantial decrease in the injury rates based on this condition. Critical strategy number 6. Craft benefit programs with worker safety and well-being in mind. Provide the flexibilities and supports so workers can actually use them. Here we're making the connection between the benefit programs that people have beyond just day-to-day working conditions, beyond work hours, those extra things that create opportunities for better health outcomes, whether it's quality health care insurance, paid sick leave, family leave. It's those kinds of policies that unfortunately in our changing economy are getting pretty rare, are getting harder and harder to see applied on a consistent basis. But we do believe they're critical to improving injury and illness rates, as we've just shown with paid sick leave, and overall health outcomes as well. I put this up to remind us that any program to improve health needs to start here. We need to start with how can we optimize conditions of work, and at that point, after that is when we are able to add on those additional things, to take those other steps to think more holistically about the health needs of workers. We have about 5 minutes left in my prepared remarks. I don't think I will need that, and that will give us time to go to some great questions that you guys have shared today. But let me just give you a few take-homes on how you can get engaged in the conversation with us. Really have some input into where we're going with this organizational approach and how we can best serve your needs as occupational safety and health professionals. We have a wide variety of ways that we can interact with folks on social media. I love our Twitter account because it's the first place that you will see late breaking news from NIOSH, It's a great opportunity for us to get new documents and new approaches, either that we've created or that we found from a trusted source that we're going to pass on to you. We're not going to bombard you with hundreds per day or anything like that, but when something strikes our fancy as, wow, this is really a game changer, we're going to first get it out on Twitter. We also have a great LinkedIn account, which is a little slower paced. It's more conversational. We have regular contributors to LinkedIn, and whenever we have sort of a discussion that we want to engage with in this community around these issues, we do it on LinkedIn. And then once a quarter, we send out an e-newsletter. It's called Total Worker Health in Action. It now reaches about 65,000 occupational safety and health, health promotion, HR, benefits, workers' comp. It's a very diverse community that's following our progress in Total Worker Health in Action. We'd love for you to sign up. It's very easy to do. Just Google Total Worker Health to do any of these things, and you're going to see a really quick way to sign up. You can also email us. Our email address is up top. I'm really fond of our webinar series. If you're someone who likes webinars, and obviously you joined today because you think this is a useful learning tool, I would invite you to take a look at our 2014 and 2015 webinar series. We started last year. You can see that we've had a number of people either attend live or view the recording, and some really important topics. The first one's just an overview of total work health approaches. The second one, intervening for work stress, was extremely popular. The next one was focused on the needs of small businesses. Now here's the good news. These were all presented before, but they're all archived. So you have access to looking at all of this content. We did one on preserving lung health, specifically talking about respiratory exposures and also about tobacco. And if you have any interest in learning about the latest scientific information around e-cigarettes and policies around e-cigarettes, I would invite you to take a look at that webinar. Our July one that we just recently had was on sedentary work, and we have others coming up in October, December, and February. The next one is going to be on work-family issues and how that interacts with working conditions and with health opportunities on the job. We don't do this by ourselves at NIOSH. Our team at Total Worker Health is only about a handful of people. 8 to 10 full-time people work on Total Worker Health at NIOSH out of the 1,100 or so full-time NIOSH employees. Most of our NIOSH staff is engaged in those traditional exposures and hazards that are far too commonplace still. But we at Total Worker Health depend on this network of affiliates and centers of excellence. We have 4 universities that we fund as centers of excellence around the country with an investment of about $5 million per year in total worker health research. And then I'm really excited about our network, our growing network of affiliates, including the National Safety Council. They are one of our Total Worker Health affiliates. So these are folks that we partner with on a regular basis. Oftentimes they're doing field studies or on-the-ground total worker health interventions that we're benefiting from. Many of them are universities that are doing research in this sort of holistic approach to worker health. And we're constantly sharing the progress that all of these affiliates and partners are making, as well as our research centers, in our various outlets, either the website, our newsletter. So this is how we're going to continue to keep the information that we're talking about fresh. Once again, I'm thankful to the National Safety Council for being a Total Worker Health affiliate. So my last strategy is that workplace safety and health is a team sport, and we want you to connect with us. We need your input. If we're going to continue to serve your needs as occupational safety and health professionals, we need to hear from you about what we're doing right, where we're missing the boat, what we need to do differently, what your challenges are so we can be as responsive as possible. Personally, total worker health matters to me because I have a 2-year-old granddaughter, and I want to optimize my work so that the rest of my life can have more quality to it. So I can see her grow up and have her own children, get married. I can enjoy to the fullest my time with those who matter to me. And that is what I wish for each of you. And that's why I feel so passionately about optimizing work so that we can really create total worker health and total well-being for our nation as a whole. So let me pause there and say thank you for your time and attention. And I do know we have about 10 minutes or so for questions and comments, and it looks like there's some great questions coming in, so I'm happy to respond to them.
Okay, well, thank you very much, Casey, and I'll just remind everyone how they can ask a question. To ask a question via the web presentation, select the chat pod in the lower left corner of your screen, then type and send your question that way. And I'm going to turn it back over to Joy to help with the Q&A session.
Thanks, Bonnie, and thanks again, Casey, for the presentation. One of the questions that we have coming in is regarding an opinion on the minimum wage. So you mentioned that wages are in correlation with health in many ways. There are some populations, however, where income is not necessarily related to health. So if you could address maybe some of the other factors that are related to health, or if you have a stance on raising the minimum wage.
Certainly. Thank you for that. And I think it's an important question and absolutely a vital national public policy discussion to talk about minimum wage. And in fact, if you look at parts of our federal government, the Department of Labor, for instance, they have fairly strong positions currently that we do need to raise the federal minimum wage. NIOSH, in and of itself, hasn't really, sort of put forth a formal position on what the minimum wage should be. So I don't have a political position or a NIOSH position to share on that topic, although I can say that the Department of Labor has spoken around that issue. But nonetheless, we know what the science says. There is a strong correlation between hazardous work and wage. Oftentimes the most hazardous jobs in this country are the least paid. There's certainly a relationship between this temporary work, contingent work, oftentimes, and low wage. Now, yes, there are exceptions. Some, especially in those proficient categories, those highly technical people who do have temp jobs or contingent work who are very highly paid. We also know that there are certain self-employed folks who have oftentimes a little bit more control over what wage is, depending on the type of, the market, the environment where they actually have their self-employed business and wage. And we oftentimes know that self-employed workers do have better health outcomes. There's something about being in control of your own destiny or your own work hours or your own sort of conditions of work that does impart positive health conditions. So one of our studies in Iowa looked at the health related to self-employment, and in general it was more positive. But if you look generally at this issue, lower wage work in general is oftentimes associated with higher risk. These workers also come from communities oftentimes with higher community and public health challenges. I read recently that the average worker today will have more than a dozen jobs throughout their lifetime, and people will have about on average, especially if you are in this temporary category, will have at least 6 periods of unemployment. So that's really one of the, if you look at overall income over the course of a year, if you're having multiple, even short-term periods of unemployment, so that your hourly wage might be high, but then you go several weeks with no job at all, that overall contributes to decreased income over the working annual income span, and certainly we know limits choice. When you have less take-home pay, your opportunities for health diminish.
Okay. All right, thank you for your answer. We have a couple other questions here on sick leave. So there's one question here on if you believe there should be a limit on paid sick leave, or should there be an as many as needed option. Additionally, along with that, I'm combining a couple of questions here. There's a concern here that California recently instituted some paid sick leave, and this organization has been seeing some issues with keeping operations going because of that. Could you just speak to the paid sick leave and an opinion on how to better implement it?
Yeah, that's a great question. Oftentimes, we do know that there's good science that show paid sick leave does have positive health outcomes, and paid sick leave also, especially in those forward or public-facing jobs, for instance, like healthcare or service industries, if people are sick and they come to the workplace with illness, they could put others at risk. So there is that additional benefit of sick leave. But I think you're right. Every organization is going to have its different set of challenges when it comes to implementing leave. And there's no one size that fits all for this. A few things that I would ask you to keep in mind. Oftentimes it's important to know what are the main triggers for sick leave. Are these people who are just trying to escape a very difficult, stressful working condition? So do we need to look at, is the nature of the work, is it a pleasant place to work? Are there conditions that are driving people to utilize more sick leave than they normally would if working conditions were better? Is it that the population has an underlying higher level of chronic health conditions and that's driving sick leave utilization? And if so, what are interventions that could be done to help with the higher burden of chronic diseases? Are there ways we can craft work, give additional supports? If that's the issue, there may be interventions that can be done on the front end for that. Is it that people are using paid sick leave because of family and home and other loved one responsibilities? And are there fixes for that other than sick leave utilization? Is more flexibility day in and day out the answer? So if I had a job that gave me much more flexibility, I wouldn't need to take sick leave because I could craft the hours that I work around my other responsibilities. So there are a number of things that may be impacting high utilization rate of paid sick leave. So the total worker health approach would be to say, get to the root of the problem. Let's find out what are the challenges people are facing, and can we as an organization craft an approach, a policy that will diminish that risk. Now, there are always going to be outliers. There are always going to be people who will be heavy utilizers. Some will game the system. Most, however, will not. And I don't think that should be our default, that we think most people will game the system, because that's not, in truth, it's not what we see. So I do think looking at the root of the problem, trying to customize the solution for your own workplace. There's no harm also in just asking workers, how can we improve work so that you are not as prone to getting ill, injured, or sick? And I think that's a good starting place. It's a great question, Joy, and there's certainly more research needs to be done in this area.
Agreed. I have another question here that's asking about if NIOSH sees an issue with confusing the Total Worker Health Program with something like Americans for Disability Act accommodations when moving somebody with diminished skills.
Yeah, that's a great question. Total worker health really is an approach, if you will. It's a strategy. It's a set of policies, practices, recommendations that will differ depending on the conditions on the ground in any one location. So we think a total worker health approach needs to be flexible. It needs to be custom built for your organization and needs, because that's what's going to actually appeal to people and have the greatest chance of success in diminishing injury and illness, keeping people safe, producing more health at the end of the day. But there are tenets within each of, like the privacy laws, the Genetic Information Non-Discrimination Act, GINA, the Americans with Disabilities Act, the FMLA policies, the state workers' comp policies. All of those have a strong interaction between this intersection of work and health. So they are all important elements that oftentimes are grouped under someone's total worker health strategy. Yes, we need to look at ADA. What is the best way we can comply with the federal requirements of the Americans with Disabilities Act and yet still broadly influence health in a positive way? How can we make sure we're protecting people's privacy under ADA and under GINA and still do these things? In general, keeping participation in these programs voluntary is a great way to start. If someone says, no, I don't want to give you information about my own personal health, letting them protect their privacy on that level makes a lot of sense to us. As you know, there are a lot of increasing criticisms of some wellness programs where privacy is not safeguarded to the degree that it should be. Keeping these programs voluntary is an important step in that direction. But I wouldn't equate total worker health and ADA. Certainly the issues raised and requirements of the Americans with Disability Act certainly influence the same set of health challenges and safety challenges that total worker health is trying to address.
Okay. Well, we are at the top of the hour. Thank you for answering that question. Bonnie, did you want to close us out?
Yes, thank you very much. Thank you for joining us for the webinar on Total Worker Health with Dr. Casey Chosewood. We appreciate your attention and participation in today's event. A recording of this webinar will be available at the Campbell Institute website, www.thecampbellinstitute.org. To hear more informative and engaging presentations on EHS topics like the one you just heard, plan on attending the Campbell Institute Symposium taking place February 25th to 26th in Austin, Texas. You can register online at www.thecampbellinstitute.org/symposium. To assist the Campbell Institute in its future webinars, please fill out the short survey currently on your screen. Thanks again for attending the webinar, and have a great day.